Tuberculosis, TB in Pediatrics, detailed answer. Tuberculosis, TB, is a chronic infectious disease caused by Mycobacterium tuberculosis, primarily affecting the lungs but can involve other organs, extrapulmonary TB. Children usually acquire infection through inhalation of droplet nuclei from an infected adult. Etiology, causative agent, caused by Mycobacterium tuberculosis, acid-fast bacillus, occasionally by M. bovis or M. africanum. Epidemiology, common in developing countries like India, higher risk in malnourished children, HIV-positive children, those living in overcrowded, unhygienic conditions, close contact with an adult TB case. Mode of transmission, airborne route, inhalation of droplet nuclei from coughing, sneezing of an infected person. Ingestion, unpasteurized milk, rare, M. bovis, transplacental, rarely from mother to fetus. Incubation period, usually 2 to 12 weeks from infection to development of primary lesion. Pathophysiology. 1. Primary infection, inhaled bacilli reach alveoli, multiply, form primary complex, gone focus, plus regional lymph nodes. 2. Dissemination, via lymph or bloodstream, spread to meninges, bones, lymph nodes, etc. 3. Activation, occurs when immunity decreases. Types of TB in children. 1. Pulmonary TB, most common, primary complex, progressive pulmonary TB, miliary TB. 2. Extrapulmonary TB, TB meningitis, lymph node TB, bone and joint TB, abdominal TB, renal, skin, or miliary TB. Clinical features. Pulmonary TB, persistent cough, 2 weeks, fever, especially in evening, weight loss or failure to thrive, fatigue and malaise, loss of appetite, sometimes hemoptysis, rare in children. Extrapulmonary TB, TB meningitis, headache, vomiting, irritability, convulsions, neck stiffness. TB lymphadenitis, painless swelling of cervical lymph nodes. Bone joint TB, swelling, pain, deformity, restricted movement. Miliary TB, high fever, hepatosplenomegaly, respiratory distress. Diagnosis. 1. Clinical evaluation, history of contact with TB case, chronic symptoms, cough, fever, weight loss. 2. Tuberculin skin test, Mantoux test, intradermal injection of 0.1 milliliter, 5-TU PPD. In duration, 10 millimeters after 48 to 72 hours equals positive. In immunocompromised children, 5 millimeters is considered positive. 3. Radiological findings, chest X-ray, hilar lymphadenopathy, consolidation, miliary modeling, pleural effusion. 4. Microbiological tests, sputum gastric aspirate for AFB, Zeal-Nielsen stain, GeneXpert cBNAT for MTB detection and rifampicin resistance, culture on Lowenstein-Jensen medium, gold standard. 5. Other investigations, ESR raised, CBC, mild anemia, lymphocytosis. Treatment, under National TB Elimination Program and India, category pediatric TB, drug sensitive. Regimen, intensive phase, 2 months, HRZE isoniazid plus rifampicin, pyrazinamide, ethambutol. Continuation phase, 4 months, HR isoniazid rifampicin. Dosage per kilogram body weight, isoniazid 10 milligrams kilogram, rifampicin 15 milligrams kilogram, pyrazinamide 35 milligrams kilogram, ethambutol 20 milligrams per kilogram. HAC drug-resistant TB, treated with second-line drugs under NTEP guidance. Prevention. 1. BCG vaccination, live attenuated M. bovis vaccine, given at birth or as soon as possible till 1 year, prevents severe forms, meningitis, miliary TB. 2. Early detection and treatment of adult cases. 3. Chemoprophylaxis, isoniazid 10 milligrams kilogram day for 6 months in, children 6 years in contact with infectious case, HIV-infected children. 4. Improved nutrition and living conditions. Complications. TB meningitis, hydrocephalus, neurological deficits, miliary TB multi-organ failure, growth retardation, drug toxicity. Nursing management, ensure adherence to DOTS therapy, promote nutrition and rest, educate family on infection control, cover mouth, ventilation, monitor drug side effects, hepatotoxicity, vision changes, provide psychological support to child and family. Prognosis, good with early diagnosis and complete treatment. Poor prognosis in miliary and meningeal TB if untreated. Summary table aspect, key points, causative agent, Mycobacterium tuberculosis, transmission, airborne droplets, common types, pulmonary, extrapulmonary, diagnostic tests, chest X-ray, GeneXpert, treatment, HRZ 2-mo, HR 4-mo, prevention, BCG vaccine, chemoprophylaxis, nursing care, drug compliance, nutrition, education,